So we have, first of all, Dr. Kate Dolan and her book, Beating Drug Addiction in Tehran, a Women's Clinic. Very interesting book. Kate is a professor of public health at the University of New South Wales. She's carried out over 100 studies and published 270 publications, and she still manages to write books. She's been a consultant for the International Narcotics Control Board, the United Nations, and the World Health Organization. A Winston Churchill and Fulbright Fellow, she established the first methadone clinic for female drug users in Iran.
Hi, thank you. I'm just going to give a little bit more of a background because you might think, how do I get to start a clinic in Iran? So it seems quite an odd thing. So after I got my psychology degree at UNSW, I went to work with Alex Wodak. I don't know if you know that name, he's quite a prominent doctor. And we started the first needle and syringe program, the first drug user group, and the first prostitutes collective, sex workers. And then we started an international group called PERT, Program of International Research and Training, and that's where my Iran work came from. So when I went to England and then to evaluate needle and syringe programs, and I got interested in prison research, and that's really been my niche. I'm kind of one of the world experts on infectious diseases in prisons. And then it was at a chance meeting in Slovenia where an Iranian doctor said to me, oh, you know, it'd be really good if you could come and help us. And I went, okay, sure. And then he invited me to Iran, and I went on this amazing trip around Iran, visiting all the prisons, which you might think is terrible, but actually was very impressive. They had needle and syringe programs in prison, which we don't have. 50,000 people on methadone, we have about 3. Well, you hardly have anybody on methadone in Queensland, in prison. It's restricted to women who are pregnant, although it's expanding slowly. So, and then when I came back, I was telling my partner about it, and I said, oh, this is so terrible. My last visit was to this women's prison, and they really need some help. And she said, well, why don't you do something about it? And then the next day she died. So I was sort of left with this legacy thinking, oh, okay. So then I started this long journey to get some money to start a program for women in prison in Iran. So I'm going to read about one woman who came to our clinic. I've got to flick through a few different sections, so excuse me while I find them. And then I don't think I'm going to take the full time allocated to me, so maybe at the end you can ask some questions or something. So it took about 6 years to get the clinic going, and when it finally got going, I didn't get there initially for a couple of years. But when I finally got there, one of the things I really wanted to do was go around and look at the clinic. We had a special women's area where the women could take off their hijab and sit and smoke cigarettes. So this is on my first visit to the clinic. One of the first clients to hesitantly step through our front door was young, using drugs and pregnant. Zara appeared so youthful, 18 years old at the most, and she was very pregnant. She was bright and bubbly, but just a girl. Her white dress made her look angelic. When she removed her hijab, her long black shiny hair tumbled down around her softly made up face. Her voice revealed excellent schooling. Zara was an unusual first client, with most others being twice her age. This suggested she may have had an unusual route into using drugs, so I was intrigued to hear how she found her way to us. Most wait until a tragedy occurred before seeking help. Zara's life away from us was unimaginable for me. Was she pacing the streets, scoring drugs in her condition? How was she financing her drug habit? Who was supporting her? Was her rupush, which is a coat they must wear, daringly short, revealing tanned legs? She almost seemed unharmed by her drug use, not at all sleep deprived. After a few weeks of attendance, she accepted an invitation to be part of a focus group. Zara removed her hijab to fiddle with her black hair and then covered her hair in a slightly different style. Her teeth looked strong and healthy, and surprisingly, it was her teeth that led her to become tangled up in drugs. At 16, she had an excruciating toothache, so her uncle gave her some opium. He placed a small piece of opium in a glass of hot tea and stirred it until it dissolved. She sipped the tea. Of course it numbed her discomfort, but it was so euphoric she continued using it. Others in her family were also opium users. She came from Shiraz, the home of the poet Hafez. The girl's story toppled out of her. She twisted her hair around her fingers and played with her hijab. As her story was being interpreted, I trailed a few sentences behind others. A serious complication with her pregnancy was diagnosed by a doctor at 5 months. The baby had a hole in its heart and it was unlikely to survive. The doctor recommended termination, a decision not taken lightly in Iran. She disagreed with the diagnosis and continued with the pregnancy. How could she disagree? He didn't say there was a high chance of having this condition. He said the baby's heart had a hole. Today she was at the 7th month mark, the beginning of her 3rd trimester. I had an inkling how she felt. 2 years previously, my twins had been born with complications at 7 months. They were in hospital for 10 weeks. Her prescribed amount of methadone was unlikely to be adequate to help her stay away from heroin or opium. Not only was it too low, but she was deliberately reducing her dose to come off completely. A ripple of shock waves flowed around the group as this admission potentially placed her and the baby in danger. Conversations ricocheted around the circle of concerned listeners. Staff urged her to consider her baby. The interpreter was chastising her for this rash decision. Another suggested we ask, why was she doing this? I won't be able to manage the bus ride here with my baby. It takes an hour, she complained. She was adamant she would taper her dose and cease methadone altogether. One after the other, we argued with her that this was a foolish move, not the best course of action. Solutions were put to her. Couldn't a relative mind the baby while she made the trip here? What about the father? What was he doing? Or the mother? Was she nearby and able to help? It's imperative that pregnant heroin users are placed on methadone throughout the pregnancy. Indeed, in some places, pregnant heroin users are often the exceptions who can receive methadone when no one else can. Zara lived with her husband's family and thought her mother-in-law would come to realise her problem with drugs if she stayed on methadone. The interpreter, a staff member, and I broke away from the circle to have an urgent discussion amongst ourselves. I wondered whether the midwife could visit her and deliver the methadone, perhaps a week's supply at once. But home delivery of methadone was against policy, so I pursued a different angle. Could the young girl be allowed to collect several days' doses at once? I knew private clinics in Iran were permitted to give several home doses at once, but only after months of attendance. So that wasn't an option. I was very concerned about the girl. If she ceased methadone treatment, she would, without doubt, resume heroin use. And using heroin when you're pregnant can seriously affect the baby. It was also unknown how serious the hole in the baby's heart was and how she would react. We had all hoped to convince her to remain in treatment. If her husband used drugs, was he in treatment? Then how was she, expected to abstain if he wasn't? His use of drugs might even depend on her continuing drug use. I tried to ask about the girl's husband, but the discussion was racing ahead and on to another issue. Patiently, I waited until there was a space for my question. The interpreter turned and said, yes, he was a user, but he was in treatment elsewhere, a little bit closer to home. I had to know why she wasn't attending there. The girl's speech was like a machine gun, leaving the interpreter struggling to keep pace. While we huddled around this poor girl, listening to her predicament, someone jumped up and offered tea. It was one of the client's jobs to serve tea. This was a welcome break for the circle of listeners who'd formed around her. One woman lit a cigarette, another went to the toilet. Someone disappeared and reappeared with some biscuits and fruit. I joked that it was no wonder all the women came here if they were given such treats. But they hinted it was because I was there. Normally there was no biscuits and fruit. So we sat drinking our tea, looking at the poor girl. Zara's immediate issue was her pregnancy. The Iranians were adamant that they should employ a midwife on the staff. I was unsure because of the role of midwife differed in Iran. Her job was more about sexual health than delivering babies. The midwife had many questions about her role when we employed her. Having worked in the field for 2 years, she was well acquainted with female sexual health, such as family planning, sexually acquired infections and HIV. But the midwife had little experience with females who used drugs and was apprehensive about cases she would be assigned. Also, her husband expressed his disapproval about the job as it might reflect badly on her to be mixing with our clientele. Demand for the midwife services was high from day one. She was an elderly lady with much life experience before and after the revolution. She was also very religious and made sure her work followed the Quran. The midwife had been called to care for this girl. She had seen her in her room, which was simple yet comfortable, to put the girl at ease. If necessary, she would refer the girl to a specialist. She counselled her about safe sex, vaginal hygiene and common infections. I was drawn to the midwife when we first met. The back wall of her examination room was blue and the side walls were white. As we entered, she rose from a desk, which was situated in one corner. An examination couch was against the wall on the far side of the room, and a medicine cupboard with all sorts of ointments sat there. Basically, she investigated female sexual health. I never quite understood how this didn't overlap with the doctor's work, because it didn't, and because she was able to prescribe medication as well. The interpreter motioned for us to resume our position to hear the remainder of Zara's story. She had fallen for the magic bullet cure. She underwent a radical form of drug treatment. The doctors claimed they would put her to sleep. When she woke up, she would be cured. Who wouldn't want to be rid of a drug habit magically and immediately? The procedure was called ultra-rapid opiate detox. The girl was given a general anaesthetic and then pumped full of naltrexone, an anti-heroin drug that displaces heroin from the body to bring on withdrawals. She did not feel any pain and she was anaesthetised and unconscious for 24 hours. On awakening, she received an intramuscular injection of what she was unsure. So she had supposedly become free of opiates. If she took a narcotic such as heroin or opium, she would respond like she'd never taken it before and possibly overdose. This treatment is similar to what ambulance workers administer to a person who has overdosed on heroin. I couldn't believe this form of shoddy treatment had surfaced in Iran. Australia had its own experience of it back in the 1990s when this form of treatment graced the cover of a magazine. The headline was, "I went to sleep a junkie and woke up cured." But by the very fact Zara was sitting here looking for treatment, it meant the magic bullet had missed its mark. Then she spoke of another attempt to become drug-free, how she had dirty blood taken from her back. I had to stop the interpreter to clarify this point. This time she was referring to cupping, an old Greek remedy, and I guess Iranian one, where a heated cup was pushed onto one's back and held there while the flesh and toxins were drawn up. I couldn't fathom how this procedure would cure an addiction to heroin. Zara underwent this procedure not once but multiple times. After 3 days she was back using drugs. The treatment cost $250 US, the equivalent of an average monthly salary for a professional in Iran. Zara was desperate to beat her heroin addiction but was poorly informed of the various modalities available. A few days later, Zara reappeared for an appointment with our doctor. Her shiny hair was dull and her white flowing dress soiled and crumpled. Her demeanour was despondent and she seemed frustrated. The interpreter and I pounced on her in a frantic attempt to cajole her into our line of thinking. Our new tack was a private meeting with Zara in the director's office to elevate the status of our gathering. Over and over we hammered in the risks of dropping out of methadone treatment, how it might affect the baby, how she might turn to drugs again. She looked sheepish at this point. It appeared she was using drugs on top of methadone, or maybe instead, maybe selling her methadone to buy the heroin. This would mean she's most likely injecting heroin as she had before, possibly in a group setting and probably sharing syringes. Okay, on my 5th visit to Iran, I had a chance to catch up with staff and clients. This visit allowed another follow-up of the progress of several women, including Zara. I wondered what outcome was for her baby and her. I put my questions to several staff, but no one seemed to know. I pestered them to quiz other clients if they had any knowledge. For several days I hassled them to discover what was her fate. What about the service where her husband was? Did they know what had come of her? If they found her, could they encourage her to come back and talk to me? She had stopped at a pinnacle. According to our most recent information, she was determined to leave methadone behind. Some time elapsed, leaving me to surmise they were unable to locate Zara for any information about her. Then, at lunch one day in the staff room, the admin came in and made a comment to the interpreter, who reacted as if she'd been bitten by a snake. The interpreter said they found Zara, she had the baby, but had been stillborn. She was very depressed, shunned treatment. The air was very heavy. We had failed her and her baby. What could we have done differently to prevent this tragedy? Everyone around the table was the mother, me with my twins, the coordinator with her boy, and the administrator was due to give birth to her second baby. We all felt her loss as a mother. So, I leave it.
Thank you.